This presentation will cover some basic topics with reference to laryngoscopes. A laryngoscope is a device used to visualise the vocal cords. It's therefore used for intubation and insertion of devices, for example a nasogastric tube. Laryngoscopes can be classified into direct and indirect laryngoscopes. Direct laryngoscopes allow direct visualisation of the larynx in sight. These can be curved or straight blades. Indirect laryngoscopes allow visualisation of the larynx by the use of specialised systems, i.e. optic or video, an example of which is a gyroscope. This presentation will primarily cover direct laryngoscopes. These contain a tip, a light source, a tongue, a flange, a hook, and a handle which contains batteries to supply energy to the light source. A typical laryngoscope can be classified into the handle and the blade. The handle can be short or standard, and the blade can be curved or straight. There's a range of different blades in each based on the indication for intubation. The main advantages of a direct laryngoscope is it's simple and low cost to use. They can be cleaned, however they're normally reusable in Western countries. The disadvantages: there's a risk of failure of the light source. During insertion, the risk of damage to structures of the airway, dental damage, and they can precipitate laryngospasm. Depending on the type of laryngoscope, there's a range of cardiovascular complications which can occur. Insertion of a curved blade into the vallecula mediates a sympathetic response and therefore tachycardia and hypertension. Conversely, a straight blade is placed onto the epiglottis and lifted, and this can result in a vagal response resulting in bradycardia and hypotension. The Macintosh blade is the most common curved blade. The blade is attached to the handle at 90 degrees. The McCoy blade is similar to the Macintosh blade. It's a curved blade, however it contains a movable distal tip segment allowing displacement of the larynx forward, and is classically used in obstetric patients. The McGill blade is the most commonly used paediatric blade. It's a straight blade and it's a U-shaped cross section. It comes in a range of sizes from 0 to 4, 0 being used in premature infants. Please like and subscribe.